Hi, I'm Laura Siminoff, Dean of the Temple University College of Public Health. Joining me are faculty experts Graciela, Jaschek, Krys Johnson, and Sarah Bass. Today, we want to talk more about the new COVID-19 virus variants that are spreading, including what it means and what getting vaccinated means in terms of individual behaviors after vaccination. So I'm going to start with Graciela. Graciela, can you tell us and talk a little bit about why we need to stop the spread in relation to mutations? My understanding is that the faster the spread, the more the mutations will pop up. And then after you tell us all about that, can we help prevent more variants by masking, social distancing, and vaccination, or is none of that going to help anymore?
Yes, the answer is yes. So viruses infect us so they can use our cell machinery to replicate. Every time a virus infects us, it will multiply, making millions of copies of itself. When new copies are made, there is a good chance that the virus will mutate. So virus mutations are common. Most of the time, the virus changes its genetic material a little bit, and it's not an issue. But sometimes the mutations make it stronger. The novel coronavirus has been mutating since it first started spreading, but the new variants circulating in the US today that originated in the United Kingdom, South Africa, and Brazil are focused to spread are found to spread more easily. Since these new variants are more transmissible, more people will get infected more quickly, which will lead to more hospitalizations and deaths. Although these new variants don't appear to make people sicker, let's keep in mind that every time mutations happen, a new and more deadly variant could arise, continuing to slow the spread of the virus, and its variants can be achieved if we maintain precautions such as social distancing, wearing masks, washing or sanitizing our hands, and using good ventilation indoors. Slowing the spread of the virus will prevent the virus from mutating more often into new and perhaps deadly variants. So the last thing I want to leave you with is I want you to underscore the fact that maintaining precautions remains important even after getting vaccinated. The new vaccines are effective against people getting severe disease and dying, but we still don't know for sure how they will stop the spread of the virus, or we don't know if it will stop the spread of the virus and its new variants. So for now, we need to keep taking precautions even after we get vaccinated.
Thanks, Graciela. And I think that's a great lead in to the question I'm going to ask Krys, which is that although vaccination is not happening as quickly as we all want, some people are now vaccinated. And I wanted you to talk a little bit about the do's and don'ts of behaviors when someone is vaccinated. And also, can you tell us when you become immune? Because I think there's a lot of confusion about whether it's after the first dose, right after the second dose. So please let our viewers understand what they could expect.
Of course. So actually, I'm going to start with the second part of that. So when do you become immune? So right now we have 2 vaccines, both of which require 2 doses. And with those, you do get some protection after the first dose, but it's really the second dose that kicks your body's immune system up to create that level of immunity. And right now, the vaccines account for a 95% immunity, which is really good, but it still means that it could fail up to 5% of the time. So while immunity up to 95% takes about 3 or 4 weeks after that second dose of the vaccine, so you need to remain vigilant through the first dose, through the second dose for about 4 weeks after that, just to be sure. You still need to make sure that you're wearing your mask, washing your hands, and being just as vigilant as you were beforehand, just in case you're part of the people that are not as protected, or like Graciela said, if you come into contact with a variant that is a little bit more effective in infecting people compared with the original strain of the vaccine, or of the virus, which the vaccine was actually created to address. So regardless of which vaccine you have and what dose you're on, you should make sure that throughout the pandemic until really it's over, that you continue wearing your mask, social distancing, washing your hands. See a lot of people saying, oh, well, I got my second dose, I'm looking forward to hugging my grandma. That's really not the appropriate response right now, because there's still a chance that you could infect her even if you are not sick yourself.
So just to follow up on that, what if grandma is also vaccinated? Would you also continue to give that advice?
I would continue to give that advice, just because there is still, especially with the variants coming around, more opportunity for the vaccine to be less effective. And I would hate for a hug or a prolonged indoor interaction be the reason that grandma is no longer here with us, or your parent who's immunocompromised.
Mhm. Okay, well, that's really good to know. So finally, Sarah, there are all sorts of myths and stories flying around about the vaccines. So can you address some of the major ones for us, or maybe even some of the minor ones that you've been hearing?
Sure. So, I mean, just like with everything new, and because things spread so quickly through social media, there have been a number of myths about the COVID-19 vaccine circulating. I'll talk about a few of them. There are so many. It would take me probably an hour to talk about all of them. But I think, some of the ones that are most seen spreading, the first one is that if you've already had COVID-19, then you don't have to get vaccinated. And this really is not true. So people who've had COVID can get reinfected with the coronavirus. And this is especially true, as Graciela and Krys just talked about, now that we have the variants in the US. We also don't know how long people are protected after getting COVID-19. And some evidence suggests that it may actually not be very long, and that the immunity that's produced by the vaccine actually lasts longer. So people should get vaccinated. A second one that I think is really interesting that's been going around is that the vaccine can affect a woman's fertility. And there's really absolutely no evidence that this is true. This was a false report that went out on social media. It got spread very quickly, that suggested that there was a protein on the coronavirus that was the same as one that's involved in the growth and attachment of the placenta during pregnancy. And this is completely false. So one of the ways we can look at that is, look at the clinical trials that were done. So in the Pfizer test, for example, there were 23 women that were in the trial who actually got pregnant during the trial. There was one who suffered a miscarriage, but she was actually in the placebo group. So, importantly, I think getting COVID-19 can actually have potentially serious impacts on pregnancy and the woman's health. So getting vaccinated would be important. Another common one is that getting the vaccine will give you COVID-19. So this is also not true. The approved vaccines don't contain any kind of live virus, so you can't get the disease from the vaccine. You may have some side effects that make you feel sick. So some people may have a low-grade fever, they might have some body aches, they might be a little nauseous or have a headache, but this is just actually our immune system activating, right? So that it's trying to protect us against the coronavirus. And usually those side effects only last a day or so. And then I think the last one that's really prevalent that I've seen is this idea that the COVID-19 vaccine will enter your cells and somehow change your DNA. Both the Pfizer and Moderna vaccines use messenger RNA to show our body what the coronavirus is, so that our immune system can mount a response to it. It doesn't enter the nucleus of our cells where our DNA is, and instead what it's doing is it's showing our cells the RNA of the proteins of the coronavirus, so that we can then easily figure out how to defend against it. So it doesn't change our DNA in any way. So, I could go on and on. There are a lot of myths, but there are also a lot of credible sources to look for to get information if you hear something about a vaccine. So a couple really good ones. There's a Johns Hopkins site that's called COVID-19 Vaccine Myths. This is a really good site that kind of breaks down each myth and why it isn't true. CDC also has a myths page on their website. So just remember that things that you see on social media are often intentionally wrong, so that they're very provocative and they spread quickly. So you really have to take everything with a grain of salt and stick to those credible sources to get information.
Okay, well, that's a really, really good advice to give people. If you hear something that sounds like it comes from a science fiction film, it's probably not true. So thank you, Sarah. Thanks for joining us today. There is hope on the horizon with the vaccine, but even if you have been vaccinated, as you heard, remember to keep wearing your mask, social distancing. Please view our videos and find links to reliable sources of information. cph.temple.edu/coronavirus. Thanks so much.